In your obstetrical care, sometimes you'll be told that there are lesions or masses or infarcts on the placenta. Sometimes if you have some spotting, they'll do an ultrasound and look at the placenta and say that there's an infarct there, or a hemorrhage, or a chorionic separation. All those things are things that we notice mostly by ultrasound. In small amounts and a small percentage, that usually does not affect the pregnancy adversely. If it starts to affect the pregnancy is when it starts to affect more of the placenta, and then it can become a very, very severe issue. As you get closer to your due date, if there are some infarcts or some spots on the placenta, sometimes that means that the blood flow to the baby may be less, and your doctor may request either more frequent ultrasounds or special tests called non-stress tests, where you get put on a monitor where we can look at the baby's heart rate for a period of time to be able to tell if the baby's doing okay, if other things need to be done. When a woman has placental infarct, she probably will not know that other than being confirmed by her physician, and usually through an ultrasound. If she has any spotting or bleeding, that could lead to placental infarcts, so your doctor may decide to do other tests to evaluate that, but you cannot just sense or tell that there is going to be or is a placental infarct. Things that can cause diseases to the placenta are mostly what my job is that we have to look at things that might compromise a baby, might require us to deliver a baby earlier or do certain medications. Things like high blood pressure, diabetes, other kinds of heart disease, history of previously lost pregnancies or late miscarriages. All those things can affect the placenta, make it so there's less blood flow to the placenta, causing a placental infarct or some other issue that might require a different treatment or intervening. And so those are things that we look for to be able to determine the best timing for delivery and treatment. Most women go through pregnancies without any complications, without any problems, to the point where you sometimes wonder, gee, should I even be seeing my obstetrician? We always like to hear the baby's heartbeat. We always like to take a look with an ultrasound if it's appropriate. We always like to make sure the baby's growing. Those are things that make most women feel better, and it's just kind of fun. However, certain things are done during the doctor's visits where we can tell if the baby's not quite growing right, something else is happening. If you feel the baby's not moving when you're 5 or more months pregnant, then you call your doctor. They will evaluate and determine if there is an issue. That is not a very high percentage. Probably less than 15% of pregnancies are deemed as high risk, so the majority do fine. And we don't want anyone to think that, gee, if your pregnancy is going well, we have to worry. And that's the purpose of seeing your physician, the purpose of calling if you do have any problems.